We are back on Morning Line. Thanks for joining us on this Wednesday. The number is 737-7587. If you want to talk to me, really, you want to talk to the two professors from Vanderbilt. We're talking about healthcare this morning, and we have some more folks that waited through the break. And let's go next to Mike. Mike, good morning.
Good morning, Nick. How are you this morning?
Good, Mike. What's on your mind?
Two quick things here. One, if I'm getting full VA healthcare benefits, do I still qualify for Medicaid? And then I have a comment. It seems like if you want the best health care package in the country, get elected to Congress.
Yeah. They got pretty good health care, yeah. All right.
So I'm not 100% sure, but I believe that your VA healthcare will act as a secondary source of coverage to your Medicaid, which means, you know, you will be able to use Medicaid and go to that VA healthcare service, and maybe Medicaid will help pay for some things, or vice versa.
Okay.
But you should probably ask someone with a little bit more specific, maybe someone at the VA. Yeah. And the issue about the what Congress has, it's true, they have great coverage.
Well, you can see this because in both the first version of the House bill and the first version of the Senate bill, Congress exempted themselves from a number of the regulations they were seeking to change.
Nuts. Yeah. It's just nuts and how they get away with that. And yeah, we vote them there, and we just keep doing it. They look out for number one.
They changed it after, to their credit, but yes, the first drafts exempted them.
That's just.
But I should say that, you know, there are that insurance that you can buy through the Federal Employee Health Benefits exchange, which is an early form of an exchange. For people who are locked out of coverage, like in Knoxville, there was a chance that there were going to be no insurers offering individual market coverage to the exchanges. Some policymakers were talking about options to maybe allow those people who had no choice of a plan to, you know, buy into the same coverage that federal workers have. So it's really good coverage, and it's kind of up there as a standard, and a lot of the things in the Affordable Care Act the requirements peg coverage offered through the exchanges to that really good health insurance.
Now, you're paying for it. Now, is it not true that when you go on, and I didn't go on the marketplace, I have insurance through my station here, but the ACA, you go on there, you go to the marketplace, and there's people that would look, and there are all types of different plans that they could choose to go on, correct? And some of them have higher premiums than others. So some people I remember seeing complaining but they went on and they bought what they thought was the cheapest one. And then they weren't getting some of the, but I mean, isn't that right? I mean, they would complain, well, this Obamacare is lousy because I bought my plan and it's not covering anything. Well, what plan did you buy? You know, I mean, there are some that have a little bit higher, but like anything, and still was relatively affordable, right? I mean.
So here's the issue. Before the Affordable Care Act, I have a pre-existing condition, so I like to call those the dark days.
Okay.
So before the Affordable Care Act, you could buy a policy, but it might cap out at $100,000, so over the entire lifetime of the policy. So you might get sick once, get in a car accident, and then that's it, no more coverage. It might not cover certain services. It might not cover, you know, we're talking about the opioid epidemic. Let's say you have a family plan, your son is addicted to opioids, you're desperate to do something to help him, and it turns out, surprise, your plan doesn't cover behavioral health care. So before the Affordable Care Act, in those kind of dark days, insurers could offer lots of different things, but there weren't standards. There weren't very many standards about what had to be offered so that the product people could buy in the individual market looked like what Congress has.
Right. Because there's meaning they could look at you and see whatever issues are pre-existing, they say, well, look, she's going to cost us money, so here's the policy we'll offer her. It doesn't cover any of the stuff she really needs.
Right, exactly.
But she'll have a policy for, you know, some basics.
If I break my arm, I've got coverage, right?
Yeah.
Or if I have strep throat, I've got coverage. But if it's for the thing that I actually need, I don't have coverage. So what the Affordable Care Act did is it said, let's look at those great plans that members of Congress have, or that, you know, you have at your station, or we have at Vanderbilt. Let's say, you know, there are 10 things that they cover, and there's a kind of, they pay out a certain amount of benefits. Let's require those plans in the exchange to do that good of a job. So people are getting better coverage.
Now, to do that, though, it costs more, which is getting to another point where a lot of people complained about it, and I'm not sure they fully understood why, which was the requirement that everyone has to do it.
That's right.
Or you're going to be penalized. And the whole idea of that is that you'll have everyone, including healthy folks, get into it, and what their premiums will do, because they're not using the benefit, helps offset those who have conditions, right?
Exactly.
Now, under some of the plans they were looking at, they were going to try to, because that, for whatever reason, Americans don't like being told what to do. All right, and so they don't, but I think I understood why that had to be in there, and I also thought to myself, who on earth doesn't want insurance? But what were they looking at? Weren't they thinking of trying to get rid of that? And if they do, how are they going to compensate for the loss of the revenues?
It's a big challenge, and it's a big challenge in insurance specifically. So I think during one of the Supreme Court cases about the ACA, Justice Scalia said, well, broccoli is good for us. Why don't we mandate that everybody buy broccoli? And the reason we don't do that is because the health of other people who eat broccoli doesn't affect the price that I have to pay for broccoli. But that's exactly how health insurance works. If I'm in an insurance pool, in an insurance market with other people who are very costly, then we are all going to have to share those costs. And so part of the reason, part of the logic that sort of economists developed and actuaries a long time ago developed and has now entered the policy language, part of the logic for a mandate is to do just what you said and get everybody, all the risks across the whole population, the bad, the good, to come together in a single insurance pool. And so that absolutely will mean that healthy folks are paying higher premiums in times when they're healthy, but health comes and goes. So healthy people are going to become sick people someday. And so it's hard. It's a hard sell because we're probably going to be healthy most years, but there are definitely going to be some years where we're not healthy.
So that's the only way you can make that work, I guess.
Exactly.
And so if all of a sudden you eliminate that, because that was one of the catchphrases, no more requirements, then all of a sudden, okay, that healthy money is out of the pool. You have a bunch of sick ones, how are you going to pay for it?
Yeah, and the really scary thing, I think, about both of the laws that were, or bills that were proposed, is that they kind of, just the same way that Andrew was talking about how the repeal is not really just a let's take back the Affordable Care Act, it is kind of let's pull back on Medicare or Medicaid in general. Just that same way, some of the bills have actually could have this unintended consequences of weakening the protections for people who do have that good coverage, employer-sponsored coverage, to kind of allow insurers to offer products that don't have all those suite of services that we expect to have. We expect that we can get behavioral health care coverage. We expect that we can be able to get maternity coverage. We expect that we should be able to go to the emergency room. And so the way that these bills were written, it could actually erode the benefits for people who have employer-sponsored, the three of us, and callers who have employer-sponsored coverage. So that to me was quite scary at a personal level as a person with a pre-existing
that's
condition.
where it hits home for all of us. How does it affect us tangibly? Let's go to Grady. Grady, good morning.
Good morning, Nicholas, and learned professors from Vanderbilt. Went to a math contest in 1963 and finished in the top 10% of the state. So, know a little bit about finances. I'll tell you what, this reverse Robin Hood insurance, that we're talking about, take from the poor and give to the rich, but under Obamacare, we did have one central location to handle this. You get 50 states involved, you're going to have 50 different health care benefits for people that they are not going to know a thing about. And thank God that she was working with the Obama administration there. I'll hang up and listen to y'all's comments this morning.
Yeah, I mean, is that some of the talk then again that, if there's a change, maybe just let the states handle more of it and it would be every state unique, maybe? Part
of the reason that we got the Affordable Care Act is because there's kind of a fundamental unfairness to that same proposition, right? Because why should it be the case that we're in this situation now? Why should it be the case that I, in Tennessee, if I'm a low-income person and I don't have any other way to qualify for Medicaid, why should I not be able to get health care coverage where if I lived right across the border in Kentucky, I could? So health care has long been dominated by the states, but the Affordable Care Act really shook that up and created uniform Medicaid standards, which unfortunately got undercut, which is why we don't have a Medicaid expansion and Kentucky does. But it also imposed a lot of rules on private insurance, and so rolling those back is going to take us back to those days where I was just looking this up before the show. So state regulations in Tennessee, there was no requirement that private insurance covered behavioral health care, and there was no requirement that they covered maternity care. So we can go back to that, but I think some people who need those services might be kind of upset that they might not be able to buy a policy with those services.
And that's what I think people are coming around and understanding to some degree. And I think most people would say all these plans and ACA could be improved. But the fact that these Republican senators and some of the Republicans obviously in the House couldn't all get together and pass this is they know, as we've seen in these town halls, that their constituents who are Republicans and voted for Trump and are looking at what's going to possibly be done. And let's face it, these politicians, they're just worried about being reelected. And they're seeing these town halls, and these folks who voted for them and are strong Republicans are saying, this is going to destroy my medical plan. And if you do this, we're coming after you. In some of these more moderate states. And there's some, they're just hardcore, that are going to see it the other way. But wow, that's what I think. People are realizing kind of what you're saying. You know, I believe in a lot of maybe the Republican platform, but what you guys are thinking of doing to me in this medical plan is something that's going to hurt my family.
Yeah, and 70% of Americans, according to a recent poll, would like to see a bipartisan effort to fix the Affordable Care Act.
And the thinking of it being bipartisan, aside from it having maybe a better chance of passing, would be what? That they would, I mean, things are so split, but what do they think they would get from something that's bipartisan?
Because they see so much obstruction. Right now we're in a situation where, okay, the Affordable Care Act, we're now back to the place where that's the status quo, but then we've got this threat that maybe the administration won't kind of do the things that they need to do to allow markets to work correctly. I think Americans recognize that people have to get together and come together to come to a feasible solution, because this is people's health care. Everyone needs health care. It doesn't matter who you voted for, you know, what your party affiliation is. Everybody needs health care, and you never know when you're going to need it.
Let's go to Lucy. Hi, Lucy. Are you there, Lucy?
Oh, yeah, I'm here.
Okay.
Well, I've been deemed by the State Board of Education as mentally retarded, and since I'm a native Nashvilleian, I came up here in Nashville. English was considered a second language, so that's my background. And what I have been doing for over 20 years now is paid self-insured. I'm paying self-pay, okay? I've been buying individual policies and whatnot.
Yeah.
So being the kind of person that I am, I've been trying to study the healthcare system for over 30 years on my own, and I've even audited a couple classes in college, you know, so I didn't have to take a failing grade, but just audit the classes because I wanted to know why health insurance was going crazy. And I've also worked for a couple of multinational companies that owned two of the largest health insurance companies here in the United States. And I also worked for a national company that owned a health insurance and an auto insurance here in the United States. And from what I remember, when they wanted self-pay for medical insurance or healthcare for profit back in the 40s, things started taking off. Then you had Medicare kick in the 60s, in the early 60s, and in the 1980s they just went crazy and deregulated all kinds of insurances in the early 80s. And that's when I started seeing people go to part-time, 32 hours a week, so they wouldn't have to give them insurance.
I remember that.
Now, this is what's affected me as a self-pay. I found out that I had like a top-tier plan in Blue Cross Blue Shield, and when I got my selection of plans, I had all kinds of which ways to go, just like in the marketplace exchange, to select a plan that would fit me. So I got in the top tier, close to the top, you know, set up my deductibles, and my premiums started going up. And this is 15 years ago. And they went up 100%, some years 30%. They never gave me a notice they would just go up. The excuse was people making $85,000 working for employers were dropping their insurance. So insurance was going up. Well, I'm not employed by anybody. My employer is not providing my insurance, and it went up. I was supplementing them. Then I found out right before Obamacare came in that people like me were paying into a system to keep employers' insurance premiums down.
Is that true, you think? Is that happening like that?
To that people who are self-pay are contributing to employer-sponsored insurance?
I mean, I don't know. I mean, I'm not sure how the connection works on that.
Yeah, you know, I'm not really sure either. I would have to say that, you know, employers' premiums have been very, very tightly connected to healthcare costs overall, as are individual market premiums, but individual market premiums kind of even more so. Because if you're part of an employer group, you're part of a big pool, and you can average across you and me and
Right. That's the whole example that he was making. They wanted to do the whole country like we do here at News Channel 5, where we have some people with health problems, other people that not, but we're all in the pool together because we're a big company, and so we're able to get a better deal with our insurer because...
And so where she's talking here about 100% premium increase some years before the Affordable Care Act, I believe that because it's just you. You're a pool of one.
Yeah, and that's tough. She's by herself and all these external forces making her pay more. Listen, we got to take a break on that note. We'll be back with our final segment right after this. Stay with us. Yeah, that's fine.